Hello, my name is Matthew Gannon. I'm doing a presentation on PET-CT basics and applications, and this is for class RIS 503, um, California State University graduate program for the radiologic science degree, Dr. Julie Smith. Okay, so let's get started. This is a presentation for PET-CT basics and applications, a simple overview. So hopefully by the end of this, you'll kind of get an understanding on what PET-CT does. It's two types of different imaging modalities that are fused together to get a diagnosis and complete an objective. Yeah. So what is PET-CT? Let's get into it. PET component is positron emission tomography, which detects metabolic activity using radioactive tracers that reveal cellular function. So that is something that you introduce into the body and you measure the radioactive dose on it. The CT component provides detailed anatomical images. So after they figure out where it's at, the CT component of this whole process we'll get the anatomy part, which is a part of a planning for how they wish to treat uh, the disease that's going on, usually, which is cancer. The combined power, like I just spoke about, of PET-CT merges functional and structural data for comprehensive diagnosis and treatment planning. And the cool thing about this is, you see PET-CT images and you see hot spots, so you understand where. Those radioactive materials are binding together to find the real spots that have the hugest risk for cancer or the cancer that is developing. So it's a very useful tool for early detection and for ongoing detection as those as the modalities are fused together. So how does it work? So the nuke med tech is going to have to inject you or somehow give you uh, a radioactive isotope. Most of the time it's FDG, fluoridexoglucose, and then the uptake, the active cells absorb more tracers due to high metabolic demands, especially cancer cells. So it fuses to those, and then the scanner will detect those gamma rays. So it's basically what they call a gamma camera. So that's the thing that the CAT scan can't do, but it's something that gamma camera can do within the PET scan, and then the CT will offer. The CT will provide anatomical information on top of that as well. So that's kind of how it goes. Why combine it with PET CT, PET with CT? I think I've been talking about this from the beginning. It reveals what is happening metabolically in tissues and organs. The CT shows the structure, it shows all the anatomy, and then the fusion improves accuracy because you can see those hot spots inside different areas of the anatomical place. And it's also a great tool in which they use to plan on treatment options, whether it be surgery, whether it be in an invasive implant or things of this nature. So the key clinical applications with oncology with PET-CT. So the detection is obviously the most important part. The treatment response, and this is evolving too, and we've seen this within this course as far as radiopharmaceuticals and specific cancer treatment for specific types of people within their cell development. So the treatment response is very necessary. Staging and restaging, obviously, um, we have to get a full body scan if someone has cancer. We gotta know where it's at or where it might be going. And then radiation planning. This is what I was speaking about. So the PET CT is kind of the standard for planning radiation therapy. So whether it be proton therapy or just there's a lot of new ones out too, but the PET CT is basically the planner for those types of uh, therapies. Okay. Other medical uses, cardiology. They've been finding out that even cancer and affects the heart in different ways. So they're trying to figure out how to use PET CT into diagnosing hearts and finding hotspots. I really haven't seen a lot of these in the field that I've come across, but when researching it, this is what I found. So I'll just go through this. Blood flow evaluation, coronary artery disease detection, which I think coronary artery disease would just go straight to the CT coronary artery exam, but neurology and psychiatry. So those are kind of like future directions and possible things that PET CT can help out with. Although I don't think these are too applicable for the basics of what um, of what it does and what it's supposed to do. So what happens when someone comes in here? It's a really long exam. They have to fast, and then they get an injection, and then they have to hang out there for the injection to allow the radioactive isotope to distribute to their body, and then kind of react to the cells in their body, and then they have the scan that even the scan they have to lie still as well for 30, 45 minutes, which is um, a lot more even compared to MRI. So it's a really difficult exam, and this is why my hat's off to nuclear medicine technicians because it's a very intimate exam. You want people to feel comfortable. You want them to feel okay. So um, then the recovery, I mean, and this is basis on what treatment they got as far as everything, but you there are guidelines for the patient to follow if they've had too much of the radiation because it can become a risk. So, okay, some more future directions. Total body scanners, which we already have, and then PET MRI integration. If we have the possibility to do that, and I think some sites do, but you have to have a really brand new MRI scanner to integrate into the PET CT era. As far as I've never seen a PET MRI integration, but I know they exist. So I know that the radiopharmaceutical side of everything, they're advancing new tracers and advancing new detection and treatment responses and all these things, and that's another thing we've learned about in our course. And PET CT is going to help out that. It's going to be right there along with it because all those radiopharmaceuticals are going to be detected through PET CT or SPECT CT. It is all a way how we can detect cancer and diseases and treat them uh, by analyzing radioactive decay and a radioactive decay um, that we insert in the body and radioactive decay with our own cells in the body. So it's very interesting, and this has been a great course for me. So to sum it up, why it matters. Early detection, I just spoke about that, and treatment optimization. So this guides therapy selection and monitors effectiveness, improving patient outcomes and reducing unnecessary treatments. So you can identify a specific cancer without having to do kind of a shotgun medicine and give them, oh, this broad spectrum of chemotherapy when really PET CT can help identify the specific type of cancer and the specific type of chemotherapy we need to administer to that patient. So it also helps with the comprehensive diagnosis because it helps with, okay, we don't know what this cancer is. We got the CT, we got the MRI, we got the biopsy, but it just really helps give you that hotspot to say, hey, this person has the specific cancer in that area and expanding possibilities. Of course, radiopharmaceuticals are always advancing, and this field is very very exciting, very exciting. There's a lot of new possibilities to come. These are my references. Thank you. I'm sorry for going over in this presentation. It's been a great year. Thank you so much, my colleagues. Thanks you, Julie, and have a good day.